Tēnā koutou katoa, haere mai, haere mai, haere mai. Welcome to this afternoon's hui on working together to improve the system. So we've got 4 fantastic presentations this afternoon, and I just want to acknowledge the tangata whenua of New Zealand, Māori, and also Aboriginal people and Torres Strait Islanders from across our colleagues and friends and family across the ditch in Australia. So firstly, we have a presentation from Kristie Dellar, and she is from the Youth Justice Psychological Services. She's a PhD candidate at Curtin University in Perth and working as a Senior Programs Officer with Youth Justice Psychological Service. Research interests include juvenile risk assessment and intervention with a focus on reducing the overrepresentation of Indigenous youth offenders in the Australian criminal justice system. And her presentation this afternoon is the overrepresentation of young Indigenous offenders, differences in criminogenic risk needs and implications for clinical practice. Welcome, Kristie.
Thanks, Ian. So like Ian said, I'm going to be talking to you today about the overrepresentation of young Indigenous offenders here in Western Australia, and having a look at some of the research we've conducted in terms of criminogenic risks and needs and some of the implications for practice. So I would just like to begin by acknowledging the traditional custodians of country throughout Australia and their connections to land, sea and community, particularly the Whakatakapokai people of the Noongar Nation, on which this presentation takes place today. I pay my respects to the elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So just to provide a bit of context, I guess, into why this was an important issue for us to research and to look into, Indigenous Australians continue to be the most incarcerated population in the world. And when we're looking at Western Australia specifically, we have the highest rate of Indigenous youth in detention compared to all the other Australian states. So Indigenous youth here in Western Australia comprise about 50% of the offending population. So in terms of the amount of Indigenous youth in custody, that's actually around about 75%. So looking at the monetary value, that leads to in excess of $30 million a year being spent just to detain Indigenous young people here in Western Australia. So that's at a cost of just over $1,300 a day per child. So that's why for us, understanding the criminogenic risk and need profiles was really imperative, so that we could try and inform the development of effective policy, I guess, directions and rehabilitative efforts to try and reduce that overrepresentation. So the purpose of this study was we wanted to expand on our previous findings. So we had previously validated the youth level of service case management inventory tool, so the YLS tool, as a valid risk assessment measure for both Indigenous and non-Indigenous youth offenders here in Western Australia. So basically we wanted to look a bit further into the specific nature or presentation of risk factors for both of those groups, and also just compare between Indigenous and non-Indigenous youth to see if there were any differences in terms of their criminogenic risk and need profiles. And then an additional aim for us was we really wanted to have a look at the most predictive risk factors from the tool to see if a shortened version of the YLS CMI could be created that could add predictive validity for both Indigenous and non-Indigenous young people. So the data for our research was provided by the West Australian Department of Justice, and it included just over 4,400 young people ranging between 10 and 18 years of age. So those that had come through the youth justice system here in Western Australia. So we've broken it down into Indigenous and non-Indigenous subgroups. For the Indigenous group, you can see that almost 80% were male and almost 60% living in regional areas. So that's outside of the major cities like Perth, the capital city here, and the surrounding areas. So including very remote and regional areas up at the top end of Western Australia and also inland. And you can see as well, so 74% were on statutory orders. So we've got diversionary orders, or we have statutory orders where a sentence has been made and the young person is either serving a community-based order or a term of detention. So you can see the majority of the Indigenous youth were on statutory orders at the time. So for our non-Indigenous subgroup, again, majority of the group were male, and almost 80% were living in urban, so metro areas. So that's Perth and surrounding metro city areas. And you can see as well, 62% on statutory orders. So a lot lower in comparison to the Indigenous youth in our sample. So what that showed us is that more non-Indigenous youth were on diversionary JDT, juvenile justice pathways, rather than statutory orders. So in terms of the measures that we looked at, so like I mentioned before, we examined the data from the Youth Level of Service Case Management Inventory, so the YLS CMI. As I said, we did validate that as a reliable predictor of recidivism for both Indigenous and non-Indigenous youth here in Western Australia. So the tool is basically, it assesses risk of reoffending, so recidivism includes 42 items, so risk factors, that are then subdivided into 8 domains. And those are the 8 empirically derived domains that we know are most predictive of reoffending in youth. So once assessment's been completed, the young person will receive an overall score, and that represents a specific risk level. So they will either be rated as a low, moderate, high, or very high risk of reoffending. So basically, the higher the total score, the higher the likelihood of reoffending. We also had access to recidivism data that was collected from official police records for 921 youth in our sample that had a minimum follow-up period of 2 years. So we defined recidivism in our research as any rearrest that occurred during the follow-up period, and then we broke that down into subtypes, so recorded as either violent offending, sexual violence, substance-related, property, and then all other offences were classified as other. So in terms of the recidivism data, as you can see here, so the overall reoffending rates for our sample was 74.8%. So that was quite high in comparison to some of the other Australian states, which are tend to hover around 50%. And as you can see, the Indigenous youth in our sample reoffended at higher rates compared to non-Indigenous youth, so almost 85% compared to 63%. So we looked specifically at all of the wireless items, or the risk factors, to see if there were any that were more predictive or more important. And what we found, so for Indigenous youth, the most important risk factor was the item actively rejecting help. So the wireless manual describes this item as a young person who's actively resisting the assistance or help of supportive agencies or people. So in our sample, an Indigenous young person who had this item marked was 5 times more likely to reoffend within that 2-year follow-up period compared to those who didn't have that item present. For the non-Indigenous youth in our sample, the most important risk factor that we found was 2 or more failures to comply. So the user manual, again, this defines this item as any formal non-compliance with any conditions, so parole or order conditions that are in place, not complying with alternative measures, escaping custody or being unlawfully at large. So what we found in our sample was that non-Indigenous youth who had this item present were 25 times more likely to reoffend within that 2-year period compared to those who didn't have this item present. So like I said before, we wanted to have a look at criminogenic risk and need profiles and compare Indigenous and non-Indigenous youth. So when we're looking at criminogenic risk, we're talking about any risk factor that increases the likelihood of engaging in future criminal behaviour. And as I explained before, it's cumulative. So basically, the more risk factors that a young person has, the more likely they are to go on and continue offending. And we refer to this as their criminogenic risk. There's also a subset of those risk factors that can be changed through intervention. So we refer to these as dynamic or changeable risk factors. So for example, substance abuse, that is a risk factor. But we also know it can be changed or targeted through intervention. So it also is termed a criminogenic need. So what we did was look at the risk and need profiles for both Indigenous and non-Indigenous youth. So as you can see here, we've got the representations of the profiles for the Indigenous youth on the left, non-Indigenous youth on the right. So what these figures are showing is any time there's a disparity between the risk and the need, it means that that domain is either being over-targeted or under-targeted as a focus of intervention. So what we found was Indigenous youth had a lot more needs that were being over-targeted in intervention compared to non-Indigenous youth. So we also, like I said at the beginning, we wanted to see, is there a specific subset of items that are most predictive and could be utilised to create a shorter version of the tool and potentially a more accurate version of the tool. And what we found was this could actually be done with both Indigenous and non-Indigenous youth. So we found a subset of 5 items for Indigenous and non-Indigenous youth actually increased the predictive validity of the tool. So you can see with Indigenous youth, the 5 items that were identified there and increased the predictive validity of the tool, and 84.8% of the cases were accurately identified. So with the non-Indigenous youth, similar items, just slightly different, however, still a subset of 5 related to kind of criminal history and attitudes, also peer relationships, and similar results. We found that improved the predictive validity and also the correct classification of cases. So as I said, we found that the shortened version of the tool, so with the 5 items, was more predictive than actually using the whole 42 items from the tool. So with the full version for Indigenous youth, the predictability of the tool actually increased. So you can see the AYJC values there have gone up, which means it's more predictive with just using those 5 items. And the same for the non-Indigenous youth. So again, the predictive validity of the tool actually increased when just utilising those 5 items as well, compared to the 42 items, which is actually just over 8 times longer. So some really interesting findings from our research. So I guess, first of all, we found that there were certainly disparities between the criminogenic risk and need for both groups, Indigenous and non-Indigenous young people. However, what we found was Indigenous youth had more needs that were being over-identified. And what we considered was this is potentially a contributing factor to the higher rates of recidivism for the Indigenous youth in our sample. So as we know, if we're focusing on the wrong areas, targeting the wrong areas of need in treatment, or we're over-servicing treatment needs, we know that we can actually do more damage. Essentially, we can increase risk of reoffending. So that was a potential causative factor there. And we also reflected on the research, and some other research has come out in the eastern states in Australia and recommend that access to cultural consultants and the inclusion of cultural guidelines with the actual YLF CMI manual could really assist practitioners who are using the tool in just making more appropriate interpretations and understanding of the actual risk factors, specifically for Indigenous youth. So if we consider the most predictive factor for Indigenous youth was the actively rejecting help item. So without considering the cultural and social context of that item, we could be potentially misinterpreting it and leading to pejorative labels such as, antisocial, defiant, unwilling to engage. Whereas if we consider the cultural context, that item from a cultural point of view could really be referring to there's a real lack of mistrust, particularly with government agencies such as youth justice services, based on a history of colonisation and trauma that has occurred. So really, again, just highlighted the importance of having that cultural lens and access to the cultural guidelines. So the shortened version of the tool, like we said, the 5 items was much more predictive and much shorter. So this could save definitely time and resources. Also, it improved the predictability and classification rates, as we saw. So I guess the main point I really want to emphasise from our research moving forward is that it is imperative that any future research and policy decisions are made in partnership with Indigenous people, and really should be led by cultural elders and experts in the area to make sure that we're really taking steps to reduce overrepresentation of Indigenous youth here in the criminal justice system, and then we're not just creating more tools for oppression of Indigenous youth. Thank you.
Kristie, thank you very much for the really informative presentation. We've got, what I have noted is the number of people attending the forum this afternoon has gone up. So that's obviously very good feedback. We've got a number of questions, and obviously we've got a limited amount of time. So I'm just wondering whether there's one here that could you explain more about how over-servicing increases risk of recidivism, please?
Yeah, absolutely. So I don't have enough time to go into the whole theory, but there's the risk need responsivity model, so the R&R model. Lots and lots of research that shows basically if we're not delivering the right intervention at the right level, we can increase recidivism. So for example, we might be over-servicing a young person, getting them involved in all of these interventions that they don't really need, and they may be associating with other antisocial peers that they otherwise wouldn't have been involved with or exposed to, and then starting, the more that they're kind of kept in the youth justice system, maybe starting to develop more of an antisocial identity, which we know all of that can contribute to an increased risk of recidivism.
You've got that, there's quite a long question from Louisa Webster, the first one. You see that? Would you like to respond to that, if that's possible? With the risk items that were most predictive of reoffending for the Indigenous and non-Indigenous groups, were the increased risks compared to the whole sample or to Indigenous, non-Indigenous groups only representative?
Yeah, so we had a look at the whole sample and then separated both subgroups. The ones that I discussed as most predictive, that was specific to just the subgroup. So the actively rejecting help was specific to Indigenous youth in our sample, and the 2 or more failures to comply was specific to the non-Indigenous youth in our sample.
Okay, thank you very much. Look, obviously you've got a number of questions there that I think people may want to reach out to you and ask them to you directly. As often as with research, it opens up, it answers a few questions, but actually opens up far many more questions. But thank you very much for the very interesting and in-depth presentation this afternoon.
Thank you.
Thank you. Now it's my pleasure to introduce our next presenter this afternoon in our work stream Working Together to Improve the System. Tamara Blakemore from the University of Newcastle in Australia. She's going to talk about Postcards from Practice, learnings from the Name, Narrate and Navigate program. Tamara is a social work practitioner with research and education from the University of Newcastle and chief investigator on the Name, Narrate and Navigate program, a specialist trauma-informed care. Her work is focused on connection-based responses to complex, chronic and cumulative experiences of trauma across justice and health settings. It's my pleasure to welcome Tamara onto the stage, and we look forward to hearing from you this afternoon.
Thank you for having me. Good afternoon, and thanks for letting me share my work with you today. So the title of my presentation is Postcards from Practice, Learnings from the Name, Narrate, Navigate program. Today, I'd like to cover 5 areas quite quickly. Firstly, I'd like to make acknowledgements of culture, connection and courage underpinning our work and our presentation here today. Secondly, I'd like to give an overview of the Name, Narrate, Navigate program and particularly highlight its value to young women we've worked with. I'd like to briefly touch on the observation of systemic and structural invalidation and criminalisation of trauma and survival from trauma. And finally, provide some information about our next steps, our Practice Pathways program. Firstly, I'd like to acknowledge that I'm meeting you here today from Awabakal lands, and I pay my respects to Elders past, present and emerging, and I pay my respects to other First Nations people joining us today. I'd also like to acknowledge the endorsement, endless encouragement and support we've received from DCJ Youth Justice, and in particular the Maitland office in the implementation of the Triple N program. I'd like to acknowledge my colleague from Youth Justice, Claire Stanners, who along with David Lowe has been instrumental in the success of the program. Finally, I'd like to acknowledge the courage and of the young people involved in the program who have provided consent to share the photographic images that you'll see as a background to this presentation and their stories, which gave us a rich understanding of their lives and our practice. Children's Court Magistrate Tracy Sheedy was really instrumental in advocating for the impetus for Triple N. It's a collaborative, community-engaged project that worked together with Aboriginal elders, young people with an experience of the justice system, and practitioners across a wide variety of fields to design Triple N. It's a preventive intervention program focused on psychoeducation and skill development for young people aged 12 to 18 years who are at risk of or already using violence. Triple N, oh, sorry, I'm going to go back a slide. Triple N also provides professional education and mentoring to workers who support these young people. The trauma-informed ethos of the program responds to the fact that the young people who perpetrate harm that we work with are often victims or survivors of violence themselves. We've seen that for this cohort, the impacts of trauma have seldom been recognised or resolved and seem to be rarely considered in efforts to prevent them becoming entrenched in crime. With leadership from Aboriginal elder Auntie Elsie Randall, the content and delivery of Triple N is focused on culturally safe ways of exploring drivers of violence and strengthening self-awareness, self-regulation and skills for connection. These life skills support engagement, participation, self-efficacy and resilience. And they're the skills that we expect to see as the result of healthy human development, but they're the skills that are most impacted by trauma. So the program for young people involves experiential group workshops, exploring emotional literacy, communication skills, empathy, power and control, blame and shame, and choice. The workshops involve psychoeducation, skill building, reflection, and learning through movement, discussion, and as you can see here, the production of visual images using photo voice. The practice principles for the program focus on validating trauma, supporting mindful engagement and skill development by using reciprocal communication and a deeply relational approach to work. I think it's really the way of working rather than the specific elements of the program that we find makes a difference to our participants. The way that we work creates this real and authentic sense of engagement with our young people, who then become key contributors to the program's design and continuous improvement, but also as collaborators in developing the evidence base for practice, often through employment back with the program if they remain charge-free after graduation. So Triple N has now been delivered to over 100 young people in both youth justice and education settings here across the Hunter in New South Wales. So the program sees achievements in 3 key areas. Firstly, engagement. The program graduates return to education, training, or start employment. Connection. Program graduates reduce their offending, but they do so often by making different relationship choices. And thirdly, coping. Triple N assists graduates to a point of readiness by strengthening their self-awareness, self-regulation and skills for connection. We really see this program as a pre-engagement or a pre-piece to your targeted recidivist program. So this is really the piece that comes before the CBT-oriented programs that gets young people to a point of readiness and to have the skills for connection and self-reflection and self-awareness necessary for those programs to make a real impact. I wanted to talk about young female offenders. I think that young female violence raises really interconnected and challenging questions for practice, often due to the way that we understand and conceptualise young women's violence. A large part of the impetus for our work arose from community-engaged research where cross-sector workers reported this increasing sense of youth violence in the Hunter, but especially female violence. Workers were telling us that they felt that female violence wasn't adequately captured in crime statistics, but there was a sense of increasing public awareness through media and social media profiles. And it seems that the statistics have caught up with those observations. Hunter sites have the third largest number of youth DV assaults across the state in 2020, reporting rates on average 3% higher for DV-related assaults and almost 12% higher for non-DV-related assaults compared to the state average. The reported rates for young women proceeded against by police for violence-related charges in the Hunter also exceed reported state rates. And for the first time in the Maitland location of our work in 2020, 52% of young people proceeded against by police for DV-related charges in 2020 were female, compared to 39% overall for the state. For the young women we work with, trauma is common. Common amongst all the young women were pervasive experiences of trauma, past, present, cumulative, and chronic in their everyday lives. That violence is gendered. All the young female perpetrators of violence we worked with identified themselves as victims of male perpetrated violence. But the dynamics are complex. While they were all victims of male perpetrated violence, most of their own violence has been perpetrated against females. This quote exemplifies that complexity of these dynamics at play. You know, a man will hurt you, but a woman will always let you down. What has struck us in our work with young women who've used violence is that they seem at the same time both really invisible and invalidated, but their actions are often sensationalized and sexualized across social media and therefore highly visible. So both invisible and highly visible at the same time. By this, I mean, for example, if we think about our Aboriginal young women, they're virtually invisible within the crime stats that break down cultural status, but don't break down cultural status by gender. That means that our interventions continue to be informed by colonised assumptions about violence across cultures, about violence across genders, contexts and systems. Young women's experience and voice is also invisible in the evidence base for our work, and their experiences just routinely seem to be invalidated across context. Yet at the same time, like we don't see in the context of our work with young men, their acts of violence are routinely filmed, broadcast, and ready fodder for social debate. We rarely ever see young women's acts of violence situated within their experience of past, chronic, cumulative, cultural, or ongoing trauma, or discussed in relation to how it factors into acts of resistance or survival. This brings me to the observation that the impacts of trauma are often invalidated and sometimes criminalised. It would seem that in this way, the systems and structures contribute to recidivism when trauma and its consequent acts of survival are criminalised. We've known about the impacts of trauma on bodies, brains and behaviour of young people for over 3 decades, yet our systems of service and support often struggle with how to incorporate this understanding into how we interact and intervene with young people evidencing these impacts in what is sometimes a daily struggle for survival. What we found when working with our young people is that contrary to existing evidence, young people were knowledgeable and skilled in navigating the legal system. But consistent with the existing evidence, they commonly perceive police in particular as unfair, unkind and uncaring. Their interactions with the criminal justice system were intergenerational, sustained, and for many seen as sadly inevitable. There was a sense for a 17-year-old Jazz here that I've just been stuck in the system too long. The quote here, and I'm going to read it out for you. These two seckies came. They stand at the door like this with their arms crossed, didn't even say one word to me, just standing there like they're trying to intimidate me or whatever. And I was asking to see my mum and if I can make a phone call. And the nurse was like, nah, you're not allowed to speak to her till you speak to the doctor. And then I started getting agitated. When the doctor came in, he was like, it's 8:30 now, you can't see your mum. After I'd been sitting there for the last 3 hours saying I wanted to see my mum. And I was like, can you get out? Can you just leave me alone, please? And he was like, yeah, that's fine, rah, rah, rah. And just kept talking. I was like, can you move away from me? And as soon as he moved away from me, I just lost it. I think that quote just highlights this continuing systemic failure to respond to young people. This young woman was there as a result of victimisation, and her trauma-related behaviours were not recognised or validated by the multiple state-based agencies involved that evening. Neither was her status then as a legal minor. Trauma-related behaviours then resulted in criminal charges for her. This is a stark example of the realities of life for young women we work with. We believe in the Triple N program, and we think that the way of working has potential to change outcomes for young people who are victim perpetrators of violence across many contexts. With the support of Westpac, commencing in 2022, we will be delivering the Triple N Pathways program. So this program will see scale up of Triple N through specialist trauma-informed and culturally safe training, mentoring and support. We'll offer places to practitioners from regional, rural and remote Australia with the opportunity to join the practice pathways and be supported to deliver Triple N in their own sites and settings. We'll still continue direct delivery of the program, but this will continue in a targeted way, providing a limited number of programs for young women, Aboriginal young people, and for the first time, young people with sexually harmful behaviour. So please, if you'd like to find out more about Triple N or register your interest for information about the Pathways program, contact either myself or our wonderful project manager and practice lead in the space of work with young women, Louise Rack. We really look forward to hearing from you. Thank you.
Thank you very much, Tamara, for a very interesting and rich presentation. We've just got one question so far, and feel free to put your questions in or comments in from Louisa. Can you see that one, Tamara? It talks about have you had much presentation of gender diversity in the work, and the data is still quite binary. Have you got some comments around that, please?
No, we haven't. We haven't had a lot of presentation in terms of gender diversity at all. That may be reflective of our small regional setting where we were, and it's very, how should I put it, conservative, traditional, you know, a way of being at this point in time. It's a very, yeah, it's a very interesting little town, but yeah, no, we haven't had, and we would be very keen to explore that more.
Thank you very much. Any other questions anyone would like to ask? Just fire them in. We've got a few more minutes.
Sorry that I was quite quick, but I was just mindful of everyone's time.
No, that's
We're
all
really,
right. No, it's all good.
really keen to hear from people who might like to find out more about being trained in the program. And yeah, the program is, the training program is quite supported, and we think quite rich.
All right. Okay. Well, look, if there's no further questions, thank you very much, Tamara, for your really interesting presentation. Clearly, a lot of great work has been done, and a lot of great work's been going forward with obviously support from financial funders, which is fantastic. So all the best in your work, and thank you very much.
Thank you.
And now on to our third of fourth presentations, and notice we've still got 67 people here, which is fantastic. my pleasure to introduce Lindsay Pearce. She is from the University of Melbourne and is going to look at multisectoral data linkage to understand health and mortality outcomes for justice-involved young people. Lindsay's a research fellow with the Justice Health and Unit at the University of Melbourne. Her research focuses on the application of quantitative and qualitative methods to examine the health and healthcare experiences of socially excluded populations, including justice-involved adults and young people, to drive evidence-informed health system improvement. Lindsay, I welcome you on the stage.
Hello, everyone. Hopefully you can see me, and I wish that I could see you. My name is Lindsay. As Ian mentioned, I'm a research fellow with the Justice Health Unit at the University of Melbourne. And I'm also an honorary fellow with the Murdoch Children's Research Institute. So thanks for having me today. Before I begin, I'd just like to acknowledge that I am speaking today from the lands of the Wurundjeri people of the Kulin Nation in Melbourne. And this is a place that I've been very grateful to call home for the last 2 years. And I'd just like to acknowledge and extend those respects to any Aboriginal, Torres Strait Islander, Maori, or other First peoples joining us today. And I'd also just like to make a note that I will be discussing mortality, which can obviously be a very difficult conversation when it's concerning our loved ones and young people in the community. So I just wanted to make that note. So these are just some objectives of the presentation today. So I'll first be illustrating the value of multisectoral data linkage to improve health and mortality outcomes of justice-involved young people. I'll be outlining 2 studies using multisectoral data linkage that's been led by not just myself, but many other colleagues at the Justice Health Unit. And then I'll finally be identifying some key challenges and opportunities to advance multisectoral data linkage for research and quality improvement purposes. So I guess a good place to start is to define what I mean by multisectoral data linkage. Essentially, this is the routine linkage of both health and non-health data. So data coming from external non-health sectors. This can include, as I'll discuss today, justice records. It can include homelessness data, education, social services, child protection, really anything that's not health related but does contribute to health. This is particularly crucial to understand health inequities of socially excluded populations because it kind of adds information on the social determinants of health and how that really impacts the health experiences of justice-involved young people. And it also allows us to generate information to inform cross-sectoral responses, which are really essential, particularly when we're discussing the health of vulnerable and very marginalized populations. This paper by Robert Aldridge was part of the Lancet Inclusion Health series. And if you haven't seen this paper or any of the papers in that series, I highly recommend taking a look. But they really, for the first time, quantified across a number of published studies, kind of the burden of disease and mortality experienced by justice-involved and other excluded populations. And really a key kind of conclusion from this was that the extreme burden of disease experienced by inclusion health populations really demands a cross-sectoral response to prevent considerable social exclusion and as well to improve services that work with these populations for a few reasons. One being that socially excluded populations are often invisible in health data. So if we're really relying just on health data, we're really going to not be able to capture them because we don't routinely collect information on their social exclusion. And they're also quite underrepresented in health data because they do experience numerous barriers to accessing care. And just to provide, I guess, probably unnecessary background in the health of justice-involved young people, given that this is a youth justice conference. But it is important to note that, as we all know, justice-involved young people experience very profound health inequities, and this is really experienced on a backdrop of disadvantage, intergenerational trauma, poverty. Really, the list goes on, and it's a very dire situation. So this was the United Nations Global Study on the Children Deprived of Liberty that came out in 2019. And this was a really important document because it really put for the first time internationally at quite a large scale this issue in the forefront. And just a year later, Rowan Borshman, who presented in another session earlier today, he's part of the Justice Health Unit, him and a number of colleagues led a global scoping review where they identified and really quantified the extent of health inequities within the population of justice-involved young people internationally. But this kind of brings us to a key issue that the Justice Health Unit as well as the Center for Adolescent Health at Murdoch Children's Research Institute is really trying to identify and fill, is that although we know there are really poor health and mortality outcomes after release from the youth justice system and after engagement, we really don't know what happens after release to really identify the things that we can be doing to improve their health outcomes. And this quote here from Dr. Margaret Chan, who was one of the Director Generals of the World Health Organization, really puts this into context that if we don't have information to kind of quantify what these problems are, then we really don't know what the problem is. It doesn't garnish a lot of attention, and these inequities will continue. So identifying this, I can't say that I'm responsible for this work, but hopefully I can present it and do some justice. This is a preliminary study and preliminary findings from a Queensland-based study that's led by Dr. Stuart Kinner of the Justice Health Unit. So essentially in this study, the goal was to kind of fill in the evidence gap in terms of mortality outcomes after contact with the justice system in Australia. In this study, there was a linkage of state-level mortality records, being the NCIS, with youth justice records for nearly 50,000 young people. And these people were in contact with the justice system from 1993 to 2014. So these are preliminary findings. They haven't been published, but they should be out soon. So just to kind of break this down a little bit, these are both survival curves. So on the left, on the y-axis, you have the proportion of individuals surviving, and on the x-axis, that's over time. So on the left, you can see Stuart Kinner and colleagues looked at the survival by sex and Indigenous status. That red line on the bottom is the mortality outcomes for Indigenous males, which unsurprisingly were worse compared to non-Indigenous males and Indigenous females and non-Indigenous females. Obviously, this is a massive issue in Australia. Over 50% of young people in the youth justice system identify as Aboriginal and Torres Strait Islander, and as we heard yesterday in other presentations, that's around 60% in New Zealand. So this is a really critical issue. When they looked at mortality outcomes based on kind of degree of penetration into the youth justice system, they found that young people that served detention orders had poorer mortality outcomes compared to those with an order without detentions. Those are people on supervision orders compared to those charged without conviction. And finally, they also looked at standardized mortality ratios. This compares mortality outcomes within that youth justice cohort compared to their age and sex matched peers in the general population. And as you can see, they're woefully disproportionate mortality outcomes across really all areas identified. And not shown here is that 1/3 of these deaths are due to suicide and 1/6 are due to overdose. Within the sample, the overall mortality rate was 4.4, meaning that the young people involved in the justice system were 4.4 times more likely to die compared to their peers in the general population. I think I just want to pause here. I think when we often look at large data sets, we see numbers, and I think it's really pertinent here just to recognize that these are individuals, these are young people, these are futures, and not only individual futures, but futures of societies and communities. So this kind of brings me to the next black box that we're hoping to fill through our multisectoral data linkage work. And that kind of relates to the fact that we don't actually know what happens between youth justice contact and death. And without any additional information, we really are limited in our ability to identify areas for prevention and intervention. So we don't actually know where to intervene, who to work with, what levers to pull. This was something that was recognized with the Australian Institute of Health and Welfare, and they put out this report in June 2018, and they identified that significant gaps in the knowledge and health of the health of justice involved young people really warrants a national data collection in the health of these young people. And a key way to do this was through data linkage. So this kind of brings me to the second main study that I'll be discussing today. And this is something that I've been working on quite intensely over the last 2 years. And this is the development of an Australian National Youth Justice Data Linkage cohort. We are doing this in partnership with the Australian Institute of Health and Welfare, as well as Yost Relation Youth Justice Administrators. So we thank them for their contributions. So essentially with this project, we are linking the Juvenile Justice National Minimum Dataset, or the JJNMDS, which contains youth justice records from 2000 to 2019 for all young people in Australia who access the youth justice system. This includes supervision and detention orders, as well as sentenced and unsentenced. So that includes people that were on bail. We're linking this to a number of national health data sets, really for the first time at this scale that we are aware of internationally. So this includes the Medicare benefit schedule, which includes primary care contacts, pharmaceutical benefit scheme, which includes subsidized medications, and the National Death Index. And at each state and territory, we're linking to admitted patient or hospital records and emergency department records. And really for the first time, this is going to give us a glimpse into what happens in terms of young people after release from custody. So it'll tell us patterns of healthcare service use, including primary, acute, and mental health care and medication use. It'll help to tell us types of health issues experienced and causes of mortality, and how this really changes over time. We know that after the time after release from custody is a particularly vulnerable time, and improving health outcomes can also assist with reducing recidivism. It'll also tell us that the risk and protective factors for poor health outcomes. So kind of those levers that we're able to pull in order to help improve the situation for young people. So this is really just a broad overview of the linkage process that we've been undertaking. Just to highlight a few things, and the first and most important one is that multisectoral data linkage involving justice and health data is indeed possible, but it is very complicated. As I mentioned, we've been working on this for over 2 years, and we've really just got all of the approvals in place just a few weeks ago, which is really exciting. But it's been a lot of work. We've had to seek ethics approval from 14 ethics committees, including 3 Aboriginal health ethics committees. So that's across all the states and territories, because we are seeking data linkage from all the states and territories. So we've involved 7 different data linkage units and 20 separate data sets that required individual data custodian approvals. So I think, I certainly appreciate the complexity, also to identify that this is a starting point. There's a lot of opportunity to add additional data sets to help expand our understanding of the role of other social determinants of health. So for example, including child protection data, education data, adult corrections, homelessness data, I think are really key ones that we are looking at including in the future. And I think just to say that I think it's clear there's, throughout the literature and what we know about multisectoral data linkage, there's really a lot of opportunities. But this review by Angela Young and Felicity Flack that came out not long ago kind of really highlighted that despite that there's been really obvious increases in the number of data linkage studies, the kind of rate that we're including cross-sectoral data linkage has been really slow to increase. And this, importantly, it represents missed opportunities for understanding and improving the health of social excluded populations that kind of require more than just health data. So I don't think I have a ton of time left. I got a notification that I think I've got probably 3 or 2 minutes left. But I just wanted to highlight some key challenges and opportunities, and on a positive note. As I mentioned, multisectoral data linkage is highly resource intensive and time consuming. So it's really important to start early based on the information that was in that previous review from Felicity Flack and Angela Young. Investment in infrastructure is really not enough. There's also challenges that service delivery and data collection by multiple levels of government kind of limits compatibility and sharing across sectors. And so just to reinforce the importance of forming coalitions and relationships with data custodians to address issues of data quality, linkage, efficiency, harmonization, and security that have really come a long way. And kind of on that same line, there's often still a hesitancy towards data sharing and public disclosure for research and quality improvement, and just the importance of working with data custodians and other sectors to communicate the value of multisectoral data linkage, which has really been demonstrated within other populations, and just to really reinforce how the ethical and security standards are really have come a long way in the last 10 years. And just to end on one final point, which perhaps is the most important point of this discussion, is that multisectoral data linkage can systematically reinforce exclusion of populations that are involved or represented in these data are not engaged in linkage and research. Obviously, this is particularly pertinent with justice-involved young people because of the woefully disproportionate representation of young people, of Aboriginal and Torres Strait Islander and other Indigenous populations in the justice system. So just to really highlight the importance of involving communities as early as possible to address concerns around data sovereignty, privacy, interpretation, knowledge dissemination. In my personal experience, this is challenging because data that is available at a national level, we're talking about a national study, really is unable to capture the really vast diversity in Indigenous language groups and geographies. So it's really important to have them as allies in our work to make sure that we are presenting and representing them in the best way that we can. So that's all I have, just to acknowledge these entities that have been highly involved in the data linkage work, and that if you have any further questions that we can't cover in discussion, you're welcome to email me, and you can also follow us on Twitter if you would like. That's it.
Phew, Lindsay.
There we go. We're back.
Thank you very much. Back. Thank you. I don't know what happened there, but thank you very much for the incredibly detailed and comprehensive presentation. Obviously, big data sets are very hard to navigate and very hard to manage, and obviously a very, very sensitive and important topic. I suppose I've got a question myself that I hope you don't mind answering. Fairly easy. How do you get your findings across the, I suppose, the table of politicians and what are you doing in that sort of sphere to try and I suppose nudge the system a bit and improve the outcomes for the young people and their families?
Yeah, I think that's a really good question. And again, if that's not happening, it's almost like, what's the point? We really need to see change, and this is long overdue change. I know, and even before I joined the Justice Health Unit, Stuart Kinner, Rowan Borshton, and Jesse Young, they've all been working very closely and in partnership with not only politicians, but commissioners and health services to really get that information in the right hands. And in terms of this project, one of our key goals is to develop a kind of a distributed governance model around what we're doing that includes decision makers, people that are advocating on the behalf of justice-involved young people, as well as people working in policy. It really can't happen outside of that. We can provide the best data in the world, but if we don't make sure it's getting in the right hands and communicating in a way that makes sense to policymakers, then we're not really doing our jobs properly. So, but I think it's a really good question, and I think something that could probably be discussed in its own session entirely. Yeah.
It's okay. Thank you very much. There's another question here. Are you measuring the incidence of suicide with young people who have experienced care, youth justice, and those who have not? And just, their way commenting, always a couple of commenting you on your great work, and totally agree it's multi-sectoral data. But yeah, any comment on that question, please?
Yeah, thanks for that comment. And to be honest, I'm probably not the best person to be answering that. As I mentioned, Rowan Borshman, his name came up a few times, and he presented this morning. He does a lot of work with this data, including the first study that I looked at, and we'll be also looking at the data involved in this national youth justice cohort. But he's a psychologist by trade and has done a lot of work with adolescents in the space of self-harm and suicide, and that's something that we've looked at in previous studies and we'll continue to look at. And I think there's also a lot of opportunity to continue working with young people directly to help contextualize what we see in the linked data, as it can kind of be a very high level. It's extremely useful at high level, but I think sometimes getting those stories to kind of elucidate what this means for populations and how to intervene is really important too. So I'm not sure if that answers the question entirely, but again, anyone can check out our University of Melbourne website, and there's a lot of description on the different projects we have. So, and again, feel free to email me. I can put you in contact with Rowan. Or
just maybe one quick question. I don't know how easy this will be, Lindsay, for you. There was a graph on the cause of death and how many more times likely than the general public are to die. Could you please show the graph again and just explain what we are seeing? Are you able to just do that one graph, please, and just run through that again a bit more slowly, probably?
I'm not hold on one second. I'm not seeing my slides. Are you shared screen right now?
That could be difficult. Possibly what the person could do if they have if they've got a question about that, they could email you. That might be the easiest thing, Lindsay. Do you think?
Yeah, sorry about that. I'm actually what's happening now, but what was the question? I might be able to just quickly answer it unless we need to move on. Oh.
Now you've gone. There's a few. We're just having a few technical issues. I think what we'll do, I think it's probably better to get that person to email you directly and ask you that question yourself. And your email address is obviously in the conference program, and they can get you on the internet, etc., can't they?
Yes, it's just lindsay.pearce@unimel.edu.au, and apologies for that. I'm not sure what happened with my slides there.
No, that's all right. These things happen.
All right, thank you.
Well, look, I just want to thank you again for your really in-depth and comprehensive presentation. Are you looking at publishing it in journals, or is it? Yeah.
Yeah, I mean, I think we definitely are aiming to publish in journals. The preliminary mortality data that I showed, that's just currently in draft right now, so should be published. But yeah, definitely that will be coming out. And if anyone has any questions about previous publications or future ones, again, I'm more than happy to answer those on email.
Lovely. Okay. Thank you very much. And we look forward to seeing more of your work.
Thank you.
Thank you very much. Well, look, our final presentation, and this afternoon are my colleagues from Tamaki Makaurau. So haere mai, tēnā koutou katoa, from our stream of working together to improve the system from Whakatakapokai, connecting the past to the present and future. There are three colleagues here, Megan Hart, they're all from Oranga-Tamariki, Neta from Oranga-Tamariki, and Ngaire also from Oranga-Tamariki. Ngaire is the Kai Whakahaere Residential Manager of Whakatakapokai. Megan oversaw the development of the bespoke induction and training program for Whakatakapokai Kai Mahi, that is the staff, and Neta is the Kai Whakahaere lead navigator, leading the embedding of the whakamana tangata across New Zealand, Aotearoa 5 secure residences. So look, we really welcome you here this afternoon, haere mai, and we're now up to getting on to 70, so you're obviously people are really looking forward to the presentation this afternoon, and yeah, haere mai, and welcome.
Tēnā koe, Ian, katoa. Tēnei te karanga, tēnei te tangi, kia tuwhiranga tātou i te wheao ki te aomara mā tihei Mauriora. Ka mahi ki te atua te kaihanga o te rangi me te whenua, ka mahi kia kingi tūheitia me te wharikahui ariki, me ngā mata waka o te ao, tainoa ki a tātou katoa i te rangi nei, pai mārire. Ka mahi ki ngā tini mate, moi mai rā. I te whānau nau mai, hara mai, whakatau mai rā ki tēnei hui nei, ki te kaupapa o tēnei rā, nō reira piki mai, kake mai, whakatau mai rā. We also acknowledge the Aboriginal and Torres Strait Islander peoples and pay our respects to their elders past, present and emerging. I extend that respect to all Aboriginal and Torres Strait Islander peoples today. E tika ana ki mihi atu ki he mihi maia, nō reira anei taku pepeha, ko mahuhu ki te rangi tōku waka, ko kaipara te moana, ki te taha ko tōku mama, ko te uri o hau te hapu, ki te taha ko tōku papa, ko te tā uti hapu, ko Ngāti Whātua te iwi, ko Ngaire Lyall tōku ingoa. Kia ora everybody, my name is Ngaire Lyall and I am the kaiwhakahaere at Whakatakapokai Youth Justice.
Tēnā koutou katoa, he uri tēnei no te aroa waka, te aroa tangata ko tūhaurangi ngā tuāhi o te hapu, ko Aneta Mihinui tōku ingoa e mihi kawatua ki a koutou. Kia ora everybody, my name is Aneta and I am the kaiwhakatere of Whakamana Tangata.
Tēnā koutou katoa, no waihopai ahau, kei whanganui a tara ahau e noho ana, ko Megan Hart tōku ingoa. Kia ora everyone, I'm a project manager with the new Youth Justice Community Homes program. We'd love to be with you all in person, but we are pleased to give this presentation on Whakatakapokai Youth Justice, connecting the past to the present and future.
Kia ora Megan. So the journey of Whakatakapokai is actually about 2 years of trying to bring a youth justice residence online. We've only got 15 minutes, so for the purposes of our presentation here, we're going to focus on 2 key areas, which are whakamana tangata, which is a way of being that integrates traditional Māori concepts of well-being and restorative relationships. And the second is the co-design process that Oranga Tamariki worked through to create a residence that drew on the social systems and values that are effective for tamariki Māori and their whānau. So Oranga Tamariki aspires for our youth justice service to be one that is based on a preventative, restorative, relational and rehabilitative care. So the 1988 Puao Te Atatu report identified that there were gaps in both practice and training of social workers. It validated the Māori experience that interventions did not fit. It also identified that this was happening because the structures of the organisation were rooted in Western values, systems and paradigms. So fast forward to 2017 and our rebranding as Oranga Tamariki, there was a prolonged and intense period of criticism from Māori communities that highlighted the concerns of that report had still not been appropriately addressed. So Oranga Tamariki recommitted to improving the system, and to underline that commitment, some legislative updates were made to the Oranga Tamariki Act, and they helped empower us to deliver services that uphold whānau, hapu and iwi as owners of and participants in a decision-making process. That whānau, hapu and iwi model is further complemented by the insertion of Section 7AA of the Oranga Tamariki Act, which makes us responsible for upholding those protection, partnership and participation principles guaranteed under Te Tiriti o Waitangi. Public health theory is an approach that challenges the existing state and questions things that are defined as problems. It asks us to break down those assumptions and consider them within the context of the social systems that they're created in. So the Whakatakapokai project reviewed how youth justice residences were operating against a te ao Māori social construct. And so for Whakatakapokai, we look to acknowledge the past to inform our present and future decisions. In te ao Māori, we have a saying, kia whakatomuri te haere whakamua, which looks at us walking backwards into our future. So the Western concept of time is that time flows in a straight line and you can be far removed from your past. This whakatoki actually speaks to the Māori perception of time as being circular, with past, present and future assessed as part of an ongoing cycle. So from that perspective, an individual carries their ancestors and ancestral knowledge throughout their life cycle. So I'll now pass the presentation over to Aneta, who will speak on whakamana tangata as a relational way of being that draws on the past knowledge of our ancestors.
Kia ora Ngaire, thank you everybody. So we're going to have a look at te āhuatanga of whakamana tangata, and this is our visual narrative to help describe everything that's encapsulated within whakamana tangata. So it's based on the navigation story of our ancestors who travelled here from Hawaii and used the stars to guide that journey across the oceans. So like them, we have also sourced or looked at a few different ones and come up with 5 core whetū, stars or principles. The first one being mana. There's a lot of ways to describe mana, but for the sake of time, we'll look at mana as being your pride, dignity, your strength, your power. Everybody is born with mana regardless of who you are or where you come from. No one has the right to take your mana, but actions can have an impact on that mana. The second one we look at is tapu. Tapu is around boundaries, restrictions and guidelines, and tapu can be put in place to help protect one's mana. Our third one looks at maureora, maureora being life force. Another way to explain that would be if you walked into a room, you'd be able to pick up on the vibe or feel the type of feeling going on in that room. That's looking at the type of maureora that's going on in there. Our fourth one is piringa, and piringa is all about coming together, working closely as a team and working as one. And then our fifth one being ara tikanga, ara being a pathway and tikanga being the right way. So without taking away the real core meanings behind these special words, if we look at it on an operational level or putting it into practice, we'd see that when tapu has been breached or broken, somebody's mana has been impacted by that. And because of that impact on the mana, the maureora has also been upset. So we look at using piringa to create a safe environment where we can have some good, well-structured face-to-face restorative dialogue and look at how we can reach an agreement on what te ara tikanga should be, how we can reset the tapu, how we can reset maureora and restore people's mana. Also within our āhuatanga is our waka or our canoe, and the main body of the canoe is being decorated with a whole lot of carvings. These carvings are representation of everything within Oranga Tamariki, so from our values to our practice standards, 7AA, Te Tiriti o Waitangi, regs, legislation, and all of this stuff. And the reason behind that is the canoe is symbolic of a residence. And so all of the stuff I've just mentioned helps to create that really strong foundation needed within the residence. Coming up off the waka is our main mast or the paumanawa. And you'll see a few little symbols on there, and those are all representations of different restorative practice tools that we use. The main sail itself, there's a triangular patterns within it known as aramoana. And the aramoana is about having different tools to be able to navigate through rough seas. So this looks at the different types of intervention tools that our staff can use. So ka tiakina te rangatahi, ka puta he rangatira. When youth are nurtured, leaders emerge. So whakamana tangata being a way of being, not a tool just to be picked up and used when we need it to, but using these 5 whetū and a te ao Māori worldview to guide and inform all of our interactions, engagements and decision making. Kia ora.
Kia ora Aneta. So just to reinforce, whakamana tangata formed the very foundation of the way that we would interact across all of our engagements. So not just with rangatahi, it was with each other, with our community, with our resources. And that was the foundation for engagement at Whakatakapokai. So we look at this whakatauki here, which captures the essence of the collective approach that Oranga Tamariki was determined to take in transformation of youth justice services. So the proverb recognises that there is a capacity for us to support people on our own, but actually by broadening our connections and working together, we become stronger and more effective. So in 2019, the youth justice age was raised to 18. So there were some estimates that the youth justice population would increase quite significantly. So Oranga Tamariki went about considering how they might cater for this, and especially how it might impact the care of vulnerable, high need and complex youth in residences. Whakatakapokai here in this slide had been operating as a care and protection residence for some time, but changes in the model of care meant that they were no longer using the on-site secure facility. So the space became available, and as you can see from the slide, Whakatakapokai is actually located in the middle of a South Auckland suburb. So on all sides, it has neighbours, there are families and a community there. Whakatakapokai also sits on the sacred lands of Waikato Tainui, who Oranga Tamariki have held a close and enduring relationship with through the hapu of Pukaki ki te Akitai. So consultation was always a feature of the relationship, but it was considered that we now had an opportunity to really elevate that relationship, and so there was a co-designed project that came to fruition, and it was really focused on looking at a very different way of providing care in youth justice residences. So I'm just going to hand over to Megan, who will walk you through what that process looked like.
Kia ora, Ngaire. As Ngaire's just said, Whakatakapokai was identified as an opportunity to develop a Māori-centred residence with a therapeutic focus, and a place that we could design and deliver a really different type of youth justice residence experience for rangatahi and their whānau. This vision meant sometimes challenging established operational procedure and practice, and challenging ourselves to think differently. All aspects of a residential environment were subject to the co-design process, including the whare itself, the operating model, pathway to change, workforce design, recruitment and induction. We were a largely non-Māori project team, and knew that we didn't have the knowledge and competence to make Māori-centred decisions. Mana whenua and tangata whenua were invited into a co-design process from the beginning, and they took a lead in conversations about what a Māori-centred residence looks like and how it feels. We started to get a really good idea of how this environment will operate and how our existing systems needed to be adapted to better meet the needs of the rangatahi, whānau and the community. There were echoes of whakamana tangata in our co-design approach. We learned how to listen, to observe, and when to speak about what we know clearly and honestly, and with purpose and care. All of this took time and patience. We undertook a relational approach, which was difficult at times. Project people thrive on tasks and timeframes, and we had to balance that desire to just get the job done with our commitment to truly engaging and learning. So returning to the table and showing our faces, trusting that we would realise a shared vision, operating with a te ao Māori lens across service delivery, guided by Te Tiriti o Waitangi, our legislation, values, purpose and principles of Oranga Tamariki was our kaupapa and our pathway forward with youth justice transformational mahi. So these were some of the broad outcomes of the co-design process. What resonated across our engagement with mana whenua was their commitment and insistence on humanising the youth justice experience for rangatahi and their whānau, and their willingness to teach us how to do this.
series of incantations, a series of karakia we call karakia wairie, which is the clearing process to clear out the place and provide protection over the area as well as the staff.
Back in the old days, the Mātua whāngai used to be based here. And they were connected to the Puao Jatatu back in those days. So I've learned from them, yeah, and coming forward. I was a young one then. But today I'm here and I've been part of the design, I've been part of the kōrero, I've been part of just sitting and learning as I go as well.
So we're at the end of the presentation, and the slide just shows some of the things that we're working through at Whakatakapokai. A really important aspect of that co-design project is that before Whakatakapokai opened, it was a project, but now it's an ongoing relationship. Mana whenua are still highly involved in our operations, and there is actually an independent evaluation of the model of care here, and that will be across a 2-year time frame. So we will be able to get some data about the integrity of the processes that we're building, and we can tweak things as we go, just to make sure that we continue to uphold those social processes, systems that are effective for our Māori whānau. Ladies, you got any last words?
Thank you. Ngā mihi.
So yeah, kia ora whānau.
Kia ora, ka pai te whānau. That's a very moving and very rich presentation. So thank you very much for your mahi and your kaupapa that you're leading to improve the well-being of the tamariki and their whānau. There's one question here. I know we've got a couple of minutes, so we haven't got a huge amount of time. What is your vision for Whakatakapokai a year from now, in about 5 years' time? And don't all speak at once. But you can all speak at once if you want to. So what's your vision for Whakatakapokai maybe 12 months out and 5 years out? Maybe one of you can do 12 months and the other, yeah.
I can talk long range.
Okay. Can anyone fire short range?
That the embedding of whakamana tangata is seen as being successful in our kaumahia confidence and competence in carrying out this vision.
Yeah, I'll totally with that.
Yeah, hand over to Ngaire for the long-term one.
So long-term, I mean, the whole point of being integrated into a community is that at some point the community should be able to take lead in the delivery of all services within the residents. So slowly over time, we're building the capacity and competence of our partners to, I guess, take over care of our rangatahi, rather than them coming into youth justice residences that look like this. So the vision is that they will return back to the community, and they're already in their community.
Kia ora. Thank you very much, Ngaire, Aneta and Megan, for your very informative and rewarding presentation. Ka pai.
Kia ora.
That's me.